So I will open the Health and Human Services Board October 12th business meeting. We do have a quorum. Let's see, 1, 2, 5, 3.
I'm here.
There we go. Been there. Chad, you got anybody else on?
Nope, nobody else. Supervisor Middleton's the only one.
Okay. We do have a quorum, don't we?
Got a quorum.
Yeah, we are.
Start the meeting.
James here, we got a quorum. Pat's here, we got a quorum.
What do we need, 6?
Who are we missing?
Oh, Doc August and Rita and
Do we have them on?
August, Sabrina, and Rita are not here.
So I think we got. Like
that new look Amy Middleton with those glasses on.
Who's back?
I didn't recognize you.
There now.
Yeah, here now and everything.
When you guys are on, when you're on WebEx, I have to have them on or I can't see you.
Okay. Well, there isn't any sunshine outside, so I guess all of us, we are in. Before I open the meeting, boss lady, lady, happy birthday.
Oh, thank you.
So, number one on the agenda is approval for the,
I was.
agenda presented.
So.
Moved in second, Madam Clerk, any discussion here? None. Favor say
Right.
aye. And approval of the minutes of September 14th. Move in second, any discussion on the September minutes? Hearing none, all for approval, say aye.
Aye.
Motion carried. Next item is public comments. Chad, do you have anything?
There's nobody online for public comment.
Hearing none, we'll move on to COVID update and we'll turn that over to Tanya.
Turn it over to Jean. Who's gonna turn it over to Helen?
Yeah, so we have some excitement
Ladies,
in the last month to help with our COVID response here at the Community Service Division. We appointed Helen Swanson here to be our COVID response manager. So I thought this would be a good time for her to introduce herself and provide the COVID update for you guys.
Great. So I have some COVID numbers for you. Our total positive cases in September, we had 849 in Polk County. Already in October, so October 1st through yesterday, we have 418 positive cases. Our percent positivity, Polk County is 16.9%, and statewide it's 9.1%. We've had some really exciting testing opportunities here. So from August till October 6th, we were doing saliva tests, PCR saliva tests in our parking lot. And we did a total of 1,585 of those tests. And a positivity rate was 24%. Starting last Wednesday, we switched up our process since the demand was so high. We're now receiving testing supplies through the state, and we are doing PCR nasal swabs. So we opened up the Highway 2 building, the same building that we did our mass vax drive-through. So last Wednesday, we started testing people through there. We've already done, we did 101 yesterday. So I think our total number is 306 we've done since last Wednesday. I don't have a positivity rate yet. Those results are still kind of trickling in. But the process is super slick. We can get people in and out in less than 5 minutes, probably, between registration and actual swabbing, and they're on their way. So that's good news. The community members seem really appreciative. Since it's free, they don't have to make appointments. They can just drive up and get tested and get on their way right away. Vaccine-wise, we did 234 COVID-19 vaccines in September. 51 of those were kids under 18. So far in October, we've done 44, and those are first and second doses. We are in the process of planning a mass vaccination drive-through for Pfizer booster shots. That messaging will be going out either today or tomorrow. So we're going to do a one-day shot. So Wednesday, October 27th from 3:30 until 6:30. Anyone that's eligible for their Pfizer booster shot could sign up on our link, and then we will do one like drive-through for them. In order to be eligible for that, you must have received Pfizer for your first dose, Pfizer for your second dose, and then we can give you a Pfizer booster.
Question now,
Yes, sir.
your Pfizer booster, that's only eligible if you have Pfizer.
Correct. Yes.
How about Moderna booster, anything?
No new updates on that yet. Yep, they're still talking about that at CDC, FDA level. They're looking at Moderna boosters and same thing for Johnson & Johnson. We don't have any marching orders to be able to administer those yet.
Thank you very much.
You bet.
What's the date on that again for the booster?
Wednesday, October 27th. That was
Morning,
just,
Dr. August.
Morning.
I have a question on the boosters. Is that for 65 and older?
yes,
Okay.
there's a couple categories. So they're recommending people that should receive the boosters. If you're 65 older, you live in a kind of congregate living setting, or you are 18 to 64 with some underlying health conditions. But then you may receive a Pfizer booster if you are 18 and older with medical conditions, or you work in an environment that puts you at a higher risk for contracting COVID. So that's like educators, grocery store workers, manufacturers. It's a pretty big. I think if you have received Pfizer as your first and second dose and you would like one, you're going to fit in that category.
Okay, thank you.
Also should have received it 6 months prior. So anyone January through April, if you received your second dose within that time span, then we can vaccinate you in October. And I think that is all the number updates. Any questions?
Yeah, I believe that we're also for I had a 39-year-old person. Pfizer. On therapy for after COVID experiment
And Moderna is approved for those third doses.
for those people.
Right. And since public health doesn't have access to medical records, if anyone has Moderna and is immunocompromised, we recommend they go to their medical provider to receive that third dose because they're able to verify that, yes, you do meet the criteria for being immunocompromised.
Thanks for the comment, Dr. August. That's interesting.
So those are a special category. We were talking about that. I just got it. July we did, hospital did 900 tests, 11 positive.
What do you positive?
11.
Okay.
900.
July we did 996 full tests. There were 4 positives for people. I guess 1492 tests. 100 positive. Number we did 1,193. 138 were positive. 74 positive for fully vaccinated. Still need to wear a mask. You're fully vaccinated. Going into stores. Not fully protected. A couple of people live. Old and 9-year-old person both got COVID at a family gathering outside. So beware. That's why I'm wearing a mask right here. Because I don't know if everybody's vaccinated. So that 5% or more than 50% will Polk County are not. I'm seeing people every day. Putting me in my staff.
Are you done, or is there any more, anybody got any more questions?
You know,
Thank you guys.
Thank you very much. Number 8, Tanya, is that on your side?
Yes. So I just wanted to bring you a quick division update.
Rita? Got any, Dr. Loggins and Rita, Madam Clerk?
Okay, so just real quick, in the 3 departments that we have, public health, we're continuing to assess our jail health services and figure out what is the right mix over there for nursing services, along with our reproductive health. We're looking at that as we've had a couple of vacancies in those positions. It gives us a good opportunity to take a look at making sure that we're doing everything as efficiently as possible. We are gaining a registered sanitarian. We had a retirement. You'll know that Patty and Hobbs, Patty retired. She was not a registered sanitarian. She was grandfathered into doing some of the tasks. The state really recommends that we have 2 based on the number of licenses and other tasks that we're doing in this area. So we went ahead and that's being recruited right now. So we'll have 2 registered sanitarians. They do the restaurant licensing, tattoo parlors, that kind of thing. Yeah.
Brian Hobbs is our main.
He's the main guy. Yep. We're still looking at the Family Connects program, that's an evidence-based prevention program that we actually have been talking about for the last few years, but then with COVID coming, that's had to take a back burner because we just couldn't take on another new program and develop it the way that we wanted it to. So we are carrying that over into next year. And it's an evidence-based prevention program that is proven to prevent the need for child welfare services down the line. So we're really bought into, in our division concept, Family Connects is going to be that. First, every live birth gets a visit from a nurse to get them connected. So we load them up with what they need so they don't end up stressed out and entering into child welfare later on when he's sick. So we're excited about that. We are continuing with our tobacco prevention, the MJC grant. Also, our drug-free communities grant is up and running. This is our first year. And we've got staff in place for that and they're doing fine with it. So you'll be seeing more with drug-free communities down the road. Polk United, we are realigning with our hospital partners to bring a better coalition. As you may or may not know, the Drug-Free Communities Grant is part of the Polk United Coalition. So we're just fine tuning with our partners to make sure that we're all on the same page. In behavioral health, we were able to successfully recruit a nurse practitioner. So we're glad about that. Katie started with us last week, was her first week. She has a mental health specialty, so we're really glad about that. We are also creating a waiver services unit. So we're taking some of our staff in the DCF Department of Children and Families, and behavioral health, and merging them into waiver services. They'll have one manager who is managing all of those programs, better management of the staff and support of the staff, but then also better coordination of care for that big bucket of C's that we call them, all of these C waiver, Medicaid waiver programs. So doing a little shifting around of our staff. And then in Department of Children and Families, we've been pretty steady there. We're just about fully staffed. We did dip down a couple of staff, but we're actively recruiting for those at this time. Continuing to standardize our teaching with our parents. We're using Parents as Teachers curriculum, which is another evidence-based program. All of these efforts designed to help parents, do a little teaching and get off on their own so that they aren't dependent upon child welfare services down the line. Also with trauma responsive and strengthening family systems, we've got all of that going on to try to support our parents so they don't need us. That's just about it. I mean, business and operations is, the glue behind all of this stuff, and they hold it all together, make sure we get our money in the door and all of that stuff. So that's my update.
Ed, some part, do you want to explain some of the things on the pamphlet?
Yeah, I suppose I could do that when it comes to the budget.
I'll just leave that up to you.
Is that next? That's number
One
5.
of these faster things, we want the detail,
Yeah, we'll
which you're good at.
get into the money here in a little. But we could turn it over to Chad for the child support mid-year.
He's our child support man.
He was
Welcome,
up
Chad.
last
We
month,
haven't
but
seen
he
you
couldn't
for a
make it, so
while.
he- Holding up to the line, yeah.
Thank you. Sorry I couldn't make it last month. Just a quick little update on the child support agency, kind of where we're at so far this year. As of May, we were fully staffed again. We kind of started the year, we were a caseworker down. And the person that we got to fill that position actually came from the clerk of courts. She was the family court clerk, which was a perfect fill because she worked hand in hand with the child support agency. So she's been there now about 5 months, and she just slid right in the position. Training has gone great. She's really kind of holding her own, and it's been a real fast kind of learning curve for her because she had that background in the clerk of courts, and so it's really worked out.
So how many staff people do you have on child support?
I'm glad you asked that. So on a federal level, we've got 6.5 FTEs. We've got 4 full-time case specialists. We've got 2 administrative specialists. One is primarily the child support. The other one we share with Corp Counsel. She helps us with the 2 duties. We've got the 2 attorneys for the county. They work, a portion of their duties are with child support. Attorney Loso is our primary go-to for child support stuff, with Attorney Malone being the backup. And then there's myself. And so when you look at kind of how the feds calculate FTEs, we're at about 6.5. So when we talk about the child support staff, I usually say we have 6 because, we've got the 4 full-time caseworkers, our administrative specialist, who's about 80% ours, and then myself. So
And they all work out of your office, out of the court center over
that's
there?
correct. Yes. Kind of an update then, what the years looked like. We brought on that new staff in May. The majority of the training has been in-house. We've used seasoned staff to help train her, along with virtual training throughout the state. In August, I had the opportunity to go to the National Child Support Conference in Austin, Texas. It's a great opportunity to kind of get a chance to network with other states and other professionals from around the nation. And, the majority of those discussions really dealt with kind of what happened this last year with the pandemic, how states and agencies dealt with the changes that we had to make, and then kind of looking towards the future and really embracing the technology nowadays and being able to reach out and still connect with people, even though we're not face-to-face as much anymore. Coming up here next week, we've got our annual fall conference, which is here in Wisconsin. It's put on the Wisconsin Child Support Agency, or the Wisconsin Child Support Enforcement Agency. We've got 4 people from our office going, myself, Attorney Loso. We've got 1 case specialist, and then our administrative support.
Where's it at?
That's in La Crosse. Last year was canceled because of the pandemic. They are bringing it back in person this year with masks being required. So we're really looking forward to being able to kind of network again with people around our state.
Facilities in La Crosse are awesome.
Yeah, it's at the La Crosse Center. So
Yeah.
yep, we're looking forward to being down there.
We just got back from there.
I have not been, so I'm certainly looking forward to it. It's going to be, it runs from Wednesday morning through Friday at noon. They've got a couple different plenary sessions where everybody's together, and then they have some breakout sessions. I'm actually presenting at one of them, myself and then Chad Wolski from St. Croix County. We're doing a session together on, it's financial roundtable.
That's
So-
good, man.
Yep, so we're going to talk about reconciliations and court order entry and the suspense list, and just kind of have a roundtable with everybody from around the state and try and pull some good ideas together.
People in the facilities in La Crosse are very professional.
And I know we booked them out about 2 to 3 years in advance, and so we've known that this was coming up, and we're very lucky and appreciative that they're still willing to hold it. They did change to a mask mandate about 2 weeks ago. Up until then, it was still kind of an optional thing, but at least we're still able to meet in person.
Folks can attend.
That's about all I got. It's just a quick little update. And what the years look like so far. I'll know more after next week's meeting.
Good.
Thank you.
Thanks, Chad. Always a pleasure. Well, you want to get into your budget, boss lady?
I'm gonna do it with my friends here. So you guys got this green handout. If you want to just go ahead and turn right to this page here. And for the people, Sabrina and Amy, we'll just have to walk through it and send it to you guys later.
Amy, I've already emailed it.
Okay, oh, okay, I'll go find it. Thank you.
The other one's emailed it.
It's this one, Amy, so we'll have to talk you through it and then.
Okay, that's fine. I'll follow along.
And Sabrina too, I know she's on. This is like a 1,000-foot view of our budgets in the most simple terms that we could put it in for you. So when you look at the 2022 budget highlights, most of our costs are driven by personnel costs and operations, right? There's two different. For the most part, it's 50-50. So if you look at behavioral health, we've got a total of 31 FTEs allocated to that department. And with the personnel cost, $2.676 million. That includes your therapist, your nurse practitioner, all of our social work staff. We divide out our business and operations staff and allocate that across all of the program areas this year. And there's still fine tuning going on with these budgets, but this is just like initial draft here. And then you look at the operations costs, and the biggest driver of our operational costs are our services that we provide to our consumers. So that's a good important thing. $2.5 million for the most part. I mean, there's also, you know, paper and pens and all of the stuff that we need to run the business, but for the most part, most of that cost is driven by service provision to our clients for our mandated services. If somebody needs to be in a placement, that's all in that line.
Did you have a full nursing staff now?
Well, in public health, I'll get down to that one. We've got some nursing staff in behavioral health that support the clinic, but we also have nursing staff in the public health department. So there's a little bit of a mix there with nurses. And then with the revenues, we're able to balance. We've got, I don't know, 30 or 40 different revenue streams coming in here with grants and contracts and levy and allocations from the state. So all of those added up together is about $5.1 million for the behavioral health department.
Does the state pretty much fulfill their allocations?
Yes, they do. Yep. So some of it is our allocation. They'll dump it in our accounts a couple times a year. Other times we have to claim as we go. Sometimes we overspend, and that's when we use our levy to backfill. And so it's pretty complicated.
Yeah.
If you ask Chad, I think it makes his head spin a little bit, and everybody else. So we always use our grants first and our contracts and allocations first, and then backfill levy dollar, last dollar spent.
And theirs is interesting because it does make it more complicated because Tanya's group receives a lot of funds throughout the year, and they'll do a lot of shifting to fill these positions. So we start out here saying something is funded from here, but through the course of the year, they get opportunities. COVID has really created a lot of
Yeah, you'll see
opportunities.
some of the assumptions that COVID, it was really hard to.
The reason why I ask if they fulfill the legislative appropriation is when I won lacrosse again on Thursday and presenting these resolutions to the Wisconsin counties that lobbied to the legislature. And it was brought out that of the money that was, first of all, the legislature appropriated, I don't think even half of what the governor had requested in his budget. And then one of the resolutions was to make sure that the counties association lobbied that the money that's appropriated is actually fulfilled. And some of the counties, a lot of them, they were only received about 70% of what fulfillment was supposed to be, what the legislature had appropriated. So the lobbying that we're doing is to make sure, it's a lot like years ago, you know, the federal gas tax was never fulfilled, you know, and then we had to pass a 2-time state referendum that yes, the money that was appropriated to federal gas tax didn't get shifted to some other department or not at all.
Yeah, so as far as we know, the budget passed at the state level and those allocations have come into us. We haven't received any contract amendments that say we're getting less. We've only received contract amendments giving us more money for COVID purposes. You've got this little pot of COVID here and they're still throwing money at us. So we have not taken a decrease in any of our contracts with the state that we're aware of.
Well, this is kind of unique here because that last statement you made about throwing money, that's
COVID, yep.
kind of the
Yep.
The norm right now, which has never happened.
Yeah, this is one-time opportunity, I guess. And so when Kathy sees that money coming in, we look at how we can offset our levy and shift it back into the general. So we're using that
Anything
COVID.
in your department that, you know, doesn't get fulfilled, make sure the county rep to the state that I know about.
Okay, so next up we have Department of Children and Families. That has 43 FTEs. Personnel costs are $3.1 million. We don't, and it may look a little skewed percentage-wise, but our highest level is a social worker level in that department. So we don't have clinical staff in that department, so you'll see that the costs are a little bit lower there. Operations is 2.96 million, and I think they've done a good job at controlling some of those placement costs. This is the one that kind of, it can be, depending on what walks in the door on any given day, you could have a really high needs kid coming in that needs placement. So that's always kind of a guess as to what we will spend because it's a mandated service we are obligated to provide. But I do think that under the DCF now they are looking at maximizing other alternatives before they jump right to placement. So they've done good at using some of our waiver programs to keep them in the community, which helps offset those costs.
We banned for any out-of-county placement right now.
Yeah, we don't have any out of state at this time, I don't believe. We do have some tricky kids coming up here, so we're doing our best to figure out how to serve them as close to home as possible. Families First Act is coming too, so that is more aligned at not sending them out. So pumping the services into the home when possible.
That's a drain.
Which is what we should, yeah.
The drain in your department.
Yeah, and every county in the state deals with that. Some of the challenging kiddos that are coming up with lack of resources here in the state to serve them.
The state hasn't fulfilled on any location.
I know there's a work group at the state working on figuring out some type of placement alternative for people in Wisconsin to use, so we don't have to send them out of state, which we'll welcome that any day. And then the revenues, again, combined, we've got the 30 to 40 different pots that we pull from, including levy, 5.586 million total. So those will balance. We are doing a little bit of shifting, like what I said in the update with that waiver services unit. So some of the Department of Children and Family staff will be shifted over to behavioral health, but it doesn't affect our overall FTE. In public health, we have 24.1. I don't know who the 0.1 is running around, but there's 24.1. It's probably a mixture of a 0.3 and a point this and a point that to get to that 24.1. Their personnel costs are higher than the operations costs. More because they're not they don't buy services. They're the service providers. So in our public health, we've got the nurses and the sanitarians and the health educators. They provide that direct service where we're not buying those services to provide to the community. So operations is lower at 402,000. Revenue is $2.2 million. All of the different funding streams and contracts and grants that we get from the state. And then we've got the medical examiner. So we've got John, who's the he's not a 1.0, he's a 0.67, I believe, or 0.7. And then he's got 2 deputy medical examiners who work with them to make that 1.22 FTE. It costs $83,000 for those positions, and the operations is $58,000, and that includes autopsies, anything else that's testing, transportation, all of those operations.
Speaking of John Denny's, our
Medical examiner's office. And then that budget is 140. Couple of assumptions that we want to make noted. 2020 is how we are basing our budgets on, and with COVID hitting us, some of our grants would let us use the grant to pay for COVID related activities. So if we had a nurse doing maternal child health and she got reassigned to COVID, we could use that money to pay a maternal child health grant would allow us to pay. So we could spend out those grants. Some of our grants would not let us do that, but the staff still got reassigned. So we had this web of reassigning staff to respond to the pandemic. Some of the grants would let us use the grant to pay, some would not. So we do believe that with our grants coming in, the grants that we've gotten throughout almost history here, we can spend, we'll be able to charge out about 132,000 that we probably didn't get to charge out last year because COVID covered it. So we had all this COVID money coming in and just no resources to be able to do the grant deliverables, but they let us use it to respond to the pandemic.
For ways to spend it.
So yeah, we left money on the table, and we don't like to do that, but we had to respond to the pandemic. So that's the assumptions that we need to know, is that we do plan on spending it, and this pandemic will end soon. If I can predict, wish the pandemic. Anyway, so that's the assumptions. We control costs where we can. We're standardizing our practice with, setting a minimum amount of client service hours that the social workers, the clinicians, the nurse practitioners that they need to meet, so that we can make sure that that level of service is met before we add more staff. So, and then I just had the 2 other. We've asked for a lobby update here probably since 2016. Budgets weren't always as good as they are now. And we never have been able to do the lobby update, but we will be updating our lobby just for customer flow, being more trauma responsive, and creating some efficiency with how our lobby is set up. And then the transportation study, I don't know if it'll come out of a contract line for us or what, but about $10,000 to actually do a transportation needs study that comes up from time to time in this committee and county boards. So we've taken it through this department and ADRC along with the Regional Planning Commission to do that study to find out what the needs are in the county.
The veteran service is under our Health and Human Services. Did he come under your department at all?
So Chad and Vince will talk about Golden Age Manor and veteran services, but they might want to add onto the community services.
Yeah, we'll touch on a few things on that. With the transportation study in particular, I have had talks with Andy. we have a veteran services outreach fund that grows a little bit every year because it's a statutory carryover. We think we'll probably try to tap into that too for this transportation study, because that's something that's grown every year and that would be a good resource. That might be,
We'll let you cover that under.
that might be something we tap into.
There's also grants that we can apply for, so it's just a matter of what the county match needs to be to be able to get that survey done. But that'll start in early 2022.
Any questions on this pamphlet here for Tanya on that? Traditionally, in October or November, I would have our, one of those meetings, that golden age itself. I think the last one we had was 3 years ago. So last year, and this year, it's really not too feasible.
No, and
I'd like to have a meeting there once a year.
yeah, once COVID has subsided a little bit, I think Dana will be more able to have us down there, but right now they just keep us. So I think last.
Golden Age report then, or is she gonna?
Chad and Vince will do the golden age. So there's an opportunity for amendments. I think we asked you guys last time if there was areas that you wanted us to focus on, that you would have that opportunity to suggest them to us. And
Yeah, we'll be voting on the budget by the statute of the state of Wisconsin. What's it gonna be this year, the 9th or the 12th of November?
The 9th of November, the board will receive the administrator's budget next
This
week
year it'll be on the third Tuesday,
on the second Tuesday.
that's the
Ninth.
or
second.
second Tuesday.
Yep, the 9th.
So it's the same day this committee meets, and then county board is that night.
November is a weird month. We have to have general government early and county board early.
I can leave for Arizona. Any questions for Tanya? Well, thank you for the presentation. You've done just a ton and pile of work, and you're very successful.
Thank you.
Remember when we argue, trimming your budget?
Can't imagine that.
It's a heck of a year for you too.
Hey, one important thing on her budget, it's proven difficult. So what we tried to do is leave the levy stable, even though COVID's offset a lot. There may be, you're going to see, especially when 2021 closes, we saw some in 2020, where community services looks like they didn't need as much money because of COVID. That's not the case. So, I mean, that's why we have to keep the levy pretty stable. We can't back it off. COVID's a weird event.
You want to take care of the next few items on the agenda then, Chad?
I will supplement the administrator.
I'll refer to him quite a bit here.
Okay.
Let me just say too, people sitting here, Tanya and Chad, do outstanding. Understanding and knowing their budgets, and I know Chad was working all weekend and last night, pulling all the different things together.
Well, you're really their boss.
Well, I know, so, but I depend on them a great deal. I want to give them all the
They
credit.
all do.
You were handed out a packet, I think, just now that may look something like this. Let me just give you the purpose today. A lot of numbers. I'm not going to go over everyone, obviously, but to give you a heads up prior to our board meeting, prior to the November vote on the budget, so that people can take a look at it and absorb it and think about it. Last year, we didn't have a chance to do this because of everything being delayed as a result of COVID. We wanted to get these numbers out to you in advance. Give you a general overview that the challenge coming into this year that I issued to the directors was keep your budgets flat. Part of the reasoning is we want to be conservative, obviously, but secondly, we've been giving money back to the general fund. So we know that there's money there that we could, rather than say, give you a regular 2 to 3% increase, let's keep it flat and then come to me with your additional requests, and I'll review those on an independent basis. So that's what we did. The result, what the numbers you'll see here, in terms of the community, and I apologize if this is not in order. I see you've got Golden Age Manor on top. Let me just hit Community Services Division. as a whole. And overall, we can say that the community service division budget is moderately flat. We didn't, in some departments it went up slightly, in some departments it went down, but it's pretty flat overall. As far as what comes out of our levy, basically, the levy is down. The amount the taxpayer is paying is down a little bit because of, if you recall last year, we started drawing money out of a health insurance fund that we had accumulated where we self-insured.
We did.
And so that is paying for things like health insurance, dental insurance, and those things are going down. So we pulled those out of the independent department budget so that they didn't get to keep that money and spend it elsewhere. We pulled that out.
Did we, Vince, did we get a recommendation from the auditor or something that we should do that?
Yes, and I think we started at about $700,000 a year that we started funding our pay
Yeah.
raises and other things, and we're actually still adding. So we're probably going to take out a little bit more going into the future. In addition to that, the one major change I think that affected community service division is we took a treatment court case manager out of the Department of Administration. That is the person who worked with CJCC
And we shifted that.
we shifted her over to behavioral health area. So that affected them a little bit in their budget. And then, as I mentioned, the reduced insurance costs of the departments, I think, is the other key thing. Regarding the Department of Public Health, we've separated that here. If you have that, I think you'll see, again, the overall budget is down slightly, and again, that's because of that shift from health insurance. Golden Age Manor, there's no changes in staffing. The staffing's at 80 people. And the other thing that has changed that you'll notice, expenses are going way up, but we also reduced the number of certified beds from 109 to 89.
Will that be permanent? Can we ever get it back?
It's possible to come back. It's a process. Obviously, we're going to have to be able to hire people and spend some money on that facility. But at this point, I would say that's pretty stable, and I wouldn't count on that changing.
We started looking at that a couple of years ago because we pay what's called a flat bed tax
Yes, we
for
do.
the unoccupied beds. We haven't filled those in a very long time, so we started looking at it. And we had to do a nursing wage study a couple months ago because GAM was so far behind. And one way we were able to balance the budget and pay for the adjustments in wages was giving up those beds. Those beds are awarded on a certificate of need. So you would have to apply, and if those beds are available based on the state's analysis of need, you apply for those beds.
And then somebody else in the state, like if you had a city or something that is run, they can pick up allotment of those beds and then.
Or a private entity, yeah.
Yeah, so that's standard for them.
It works that way with skilled nursing facilities and with hospitals. Basically, what is the certificate of need? What is the necessary?
Dr. Lagas, your hospitals do go on the same cities you're allowed to certify for so many, so does your hospital pay a flat number of bed rate?
Suspect. So I know that they're trying to get approved for more beds.
That would be temporary basis. Rita, you've been involved in something like this.
I think all the facilities pay for the number of beds, you
Yeah.
know, and the idea is to keep them filled. To not have more beds than need.
I know in the past that's been a financial.
It is, and that was a tough decision, but, we looked
Yeah, you
at,
never want to give up anything, but
we looked at 10 years of history and that kind of stuff and the cost where we needed. Why pay for something we're never going to be able to fill?
Not even using it.
when a new entity started in the county, like this Amory memory care, so how do they have to buy up?
They're licensed differently. They're more of a CBRF rather than a nursing home.
So they're kind of in a different division.
There's no certificate of need. CBRF, they can be as licensed, whatever they can.
I think that facility has affected Golden Age and a couple other ones.
Depends on the level of care. So nursing home is higher level of care need than a CBRF. So there should be a continuum as a person's care needs increase. The
I think those are short-term.
CBRF.
But they have some long-term care.
It all depends on your
Yeah.
care.
Yeah, I mean, and they get, yeah,
Not a lot of skilled care is going on in a CBRF.
custodial.
It's just for the nursing home.
So I would just say, take a look at this, especially you supervisors, and if you see something in there, call Chad or myself. If you want to talk prior to either Tuesday night, we can do it then, or the Thursday, or
November 9th. But actually, amendments can be that night. They don't have to be on the agenda. They can come up, and we did that last year in creating a new position in.
You're giving Chad a headache here, but.
We're trying to roll out things a little earlier, so maybe you can give me the amendments earlier.
Right.
So
So
I'm not having to
hopefully,
try to math. at the
come
last
Tuesday
minute.
evening, at the board meeting next week, that's when I think most of the amendments will come forward. And we hope so, but certainly it can change up until we vote in November.
Your job has progressed very, very well as far as having these things done ahead of time. And I remember when we sat here 2:30 in the morning, we had to adjourn. And well, did we just recess or did we adjourn? And we had to be back at 9 o'clock the next morning and find out from a council, well, where are we at?
Well,
Get done by
again,
noon.
I give Chad and his staff and the directors the credit because he's the one that had the whip on them and they delivered.
This is just how much our system has progressed.
Hey, one thing that, so also in there is your veteran service budget
Yeah.
and your child support budget.
Yeah.
GAM is finalized, VSO is finalized, veteran service is finalized, corporation council is finalized. Public health and community service, the over or under numbers are final. It just may be the lines that adjust, but levies finalized. Okay. So, but the others are finalized. Those will be finalized today. It's like the last bit. But those are all included in your package.
Bill,
One question. So we got the one extra sheet here, that came, and there's funding. Just a question on outside agencies. You had kinship in there at 38,000. Is that over and above what the county is now providing them?
Thank you for bringing that up. No, that is what they requested and that's what the county will be funding them. It really will not be coming out of the Community Services Division budget. We just put it in here because it's related to your
it's affiliated with.
right. But in fact, what we've done is now transferred that and it'll go through general government.
Okay.
But those are the outside agencies that we thought were related to you. The other two things on that sheet are really the additional expenditures that Tanya had requested for her division, and they deal with the remodeling to make it more customer friendly, allocating some space for storage and that type of thing.
Thank you.
So where are we at then?
Actually, Mr. Chair, can I ask a quick question of Vince? Can I ask a follow-up? Vince, this is on the topic of kinship. What is the mechanism, once the county allocates the funds, what's the mechanism or timing in which then that money gets transferred to them? Is that kind of seamless, or is there some other hoops that they have to go through?
So once it's approved, it'll go out, and we usually try January, don't we?
Yeah, kinship runs a little different. Some of the places invoice us first of the year, some of the outside agencies. Kinship invoices monthly. So they submit 12 invoices. They
Oh.
start invoicing monthly in January.
I see. Oh, so it's an invoice thing. Okay, thank you.
I don't see any amendments under 12 and 13. Nobody has anything on the floor. You want to go ahead and, Chad, move into ARPA?
Sure. Light up. They get a copy.
They do. They have
Okay, you got a copy of those. And there's actually another page on there that has local, but I'll start.
I can view.
Is that the pack?
Was it? It's right over there.
I got it. I didn't see that.
Okay. I see the light over there.
If, I know the supervisors will recall at the last board meeting, we discussed the process of determining how to spend the ARPA money. And the gist of it was we wanted to focus first on county-centric programs. But we also wanted to recognize and consider those that are considered more local community projects. And so I've separated them into the different categories. Thank you, Kathy. And then I highlighted in yellow those that I thought would appeal or be mostly related, could be related to this body. If you recall, infrastructure, parks, trails, recreation, environment/water quality, and health and safety. So those yellow ones there. So this is just simply a start. Now, what I'll ask, and probably the next step then, is over time, we discuss this each month, we will start prioritizing and digging into. So, for example, I can tell you that some of these proposals that have come to me have simply been in an email. For example, if you look down under health and safety, one person sent an email and said, we need mental health emergency housing, we need inpatient treatment for drug and alcohol. And that was it. There was no idea, there was no specific thing. But I think they're worthy of consideration. And this group might say, this is the beginning process. If this committee or the supervisors come back to me and say, we really need to dig into the website for farm and food business and marketing, come back with a potential proposal or give us the specifics on that. And in that case, we have to give cost. Now that one, for example, I brought up, that was one that Amy discussed with me because we have such a strong heritage of local farmers here. And people are doing the healthy foods and we're getting into the agritourism business potentially. And we thought, could we create a website? Could we do some marketing for that industry and those involved in that?
Very interesting. Thanks for that input, Amy.
Yeah. So you'll see there in the environment and water quality, Bob from Environmental Services and his staff submitted a variety of different ones dealing with water quality and pollution prevention initiatives. That's kind of related to the conservation and groundwater programs. And I've tried to distinguish, whether it's a yearly fee or whatever. On the bottom, on the command post, what we learned over the past 6 months, especially, is the old command post that we have, the old motor home.
Yeah.
It's old and outdated, and it's, I don't know how many old years.
That's from 9/11 funding.
Yeah, so it's quite old. So we put that on here. We don't know the exact cost. I mean, it could be $500,000, or if you buy
We're gonna look into researching a new unit or something under government supply or.
again, and that's if you all recommend that. I mean, obviously, we're not going to dig deep into each one of these and do a fiscal analysis, but I think this committee or the supervisors will come back. You don't have to do this today, obviously, because we're not ready for that, but to say,
It's a situation, you know, where the average supervisor, how do they know anything about a project like this? Well, I was on the board when we bought that command post as a government supply from 2011. And we have it at the fairgrounds when that tornado went through basically Barron County and all that. We've had it down in Richmond and a few years ago, I think we spent 42,000 updating radios and that. But yeah, it's like every so often you're gonna trade in a vehicle and I just wanna put that out there that we really need a command post. There'll be a time when something like that can save lives and help the situation.
Did you guys use that with the COVID?
But yeah,
Yeah, I think we've used it
for giving
more
shots.
than it's ever been used in its 20 years.
Yeah, I
And
think
it's showing the wear. The other, we would use it more on a public health format to do more mobile services out in the community. So working with the sheriff's department on how we maximize something that.
And over the years, it's been used a lot in training. And I think they've even taken it to schools, EMT classes and different things like that. So I just want to take time to kind of express the need in some of our county things like that.
They used up in Burnett County and such.
Yes.
Yeah. Really something that we should work on.
But we were not able to use it during the 2019 tornado because the radio systems in it are so outdated.
So Vince, when it comes down to the full county board, I know they're gonna go through maybe even like general government or something, and my experience in being sitting in on their board. If it's not something on the agenda and expresses a high need, they deem, and I can think of instances with things been underfunded or not funded. So is there a chance maybe these things are on our agenda? Is there something that maybe we should have a resolution of support
well,
from our committee?
and we're gonna discuss all these in the committee as a whole. You know, I think that was the process we were gonna take. At this point, what I would like you all, and I think the purpose of this is for you to look at all the different things. And then maybe next month, if we want to put this on the agenda, this committee
Well,
could
there's
say,
really,
pardon?
next month is, we're really under a short timetable there.
Well, these are,
I think that legally, couldn't somebody have a motion of support for a update on the command post?
I do think it's important, and this came up in the WCA call yesterday. It's important to recognize that there's the budget process and there's the ARPA process. That is one thing. Portage County spoke yesterday because they've really been a leader on the ARPA funds. And it was interesting listening to their administrator stress that, and I think it was a key takeaway. We have the budget process, which is our annual thing. ARPA is separate.
Yeah, this is strictly under ARPA.
Right.
Can I ask you a question about that? A follow-up, Chad, do we have a particular timeline that we need decisions from the board on this matrix of ideas?
As the administrators expressed before, 2024 is the commitment date, 2026 is the expenditure date.
Oh, yeah, that's right. Okay, thank you.
Okay, Tanya, maybe that's one thing we'll have when we get down to matters of support. Let's put that on the November agenda.
Question.
Yeah.
How much
I do
funds
not
do
know.
we have?
Yes. We have received 4.235 million and we're scheduled to get an equal amount in May, but that's not guaranteed.
Excuse me for, go ahead.
What's ARPA stand for?
what?
That's what ARPA stands for.
ARPA is American Recovery Plan. And that's a result of, after COVID, the idea is the economy took such a hit, they pumped a bunch of money back to the counties and to the local governments, to try and force the economy to kind of reboot, gain strength again. And initially it came out directed toward infrastructure related to healthcare and broadband and water and sewer. Since then, we found that because of COVID, we took a loss from a revenue standpoint as a county. And so we actually have determined that we can appropriately take that first $4.25 million, really spend it more liberal.
Really, you don't get the numbers on the county board. But we've already, our Polk County's allotment under ARPA is 8.4 million. We've already got like over 4 million in the bank, don't we?
Yeah. The first payment in the bank, it's collecting a little
When you
interest
don't
rate.
qualify for it, we'd have to send back. These are, we're trying to categorize the qualification.
So these are just the categories. I wanted you to take a look at them so you can look at them in a big picture. On the back page are the local, and even though, remember at the board meeting, we said, let's be community or county centric, but let's also look at different projects locally. And, the ones that, Amory has been working on, some people there have been working on getting a swimming pool. And now they've talked to the high school, they've talked to the hospital, and they're saying we can combine this with a rehab and a daycare center to make this a community project. The Clayton well replacement, as we've talked about briefly, their manganese issue there, unlike Balsam Lake where they could just switch to other pumps, they're stuck. So right now they have to replace their well. The active adult living facility, you've heard about that in St. Croix Falls. A group of citizens there are trying to get that type of development going. And Big Ground Lake has an alum treatment coming up that they want support. And below that, I think this is an environmental services, but it says Half Moon Lake Cleaning Station. We did pass a resolution where we are requiring folks that if there is a cleaning station at a lake, you have to clean your boat off when you pull it out, boat trailer. In addition to Half Moon Lake, I just got a call from Bone Lake. They want to purchase a cleaning station as well. So that's why on the previous page, I think I put up set up fund for lake treatment. Maybe an idea, instead of every lake just saying, hey, we want to do this on their lake this year, and that one lake may not have a issue with an alum treatment right now, but in 5 years they might. So one thought is you just create a fund to support, maybe issue out grants to different lake associations.
On this situation is where I kind of have a problem.
Yeah.
Because Cedar Lake has already done their elm treatment, and that's $2.2 million. Balsam Lake has done one, and it's a heck of an expense. And the people that are paying at 2.2 million are the lake owners and in the watershed. And they've been, right now, they're talking about splitting a cleaning station between Cedar Lake and Big Lake. And I don't know, that's, to me, if you start getting into that elm, you're gonna have a big ball of fire going.
And you're exactly right. And that's why
Yeah.
I think the board chose to go county centric. However, there may be special circumstances or opportunities that you say this warrants. That's all we're doing there. And that will be the main discussion for the next couple of months.
I'm on the same thing with Joe there. I'm on the Big Lake, Round Lake Community Association. And they apply for grants on this elm
Yeah.
treatment and that every year. So if we would go ahead and fund something like that now, then that comes off their grant list. And then we're probably jeopardizing their future, on something like that. So I think those things, we gotta be extra careful that we don't duplicate something with the Lake Association, Joe, right?
If anything, just they need more education for grant writing and stuff. Because every lake can get the grants.
Absolutely.
So that's
A
the purpose of
discussion.
this, is simply to get people to
Yep.
start talking and thinking through the process. Then as a committee, if we want to discuss it, if you all say, we think these one or two things or three things are extremely important, then staff will dig into it. We'll do it anyway, but we'll dig more into it so that we can make the case.
And as long as we have county board people here, Amy and Fran and that, can I explain a little bit on East Farmington, theater building? The Air Base 674th Air Base in Farmington was built in 1950 and it was closed in 1974. And I was on the town board and chairman of Farmington. And so the air base itself was put up for sale. And in case the radar, it was a 674th radar. 9 of them stations around Greenland, that United States had control of. One in Duluth, one in Antigua, Wisconsin, up in Minnesota. And anyway, when they were closed, they were put up for sale by the General Services. If you were a government entity, you had first chance under 5 different qualifications. So I wrote up 5 different qualifications. Education, like for 4-H youth groups, seniors, there's a 12-inch cement poured well there. And I wrote a potential fire station and things like that. And anyway, although they had bids over $1 million, the town of Farmington did get the, what they call the Decatur site, which is 2.5 miles north of the original radar station, because in case that was bombed, that the power plant would be intact. There was a building there, it's a cement block building, and we done some certain remodeling of it. But the cement and everything in the summertime, if you got a hot day, it's just covered with condensation and that. So what you see under those 2 things there is in this October now, come from the Farmington Town Board meeting Monday night. They have a contract with J&S to tear down that building for $53,000, and then to haul it away and worry about another $40,000. And they want to build just a open air shelter type facility.
Well, the Gator building restoration is done, is gone.
Not yet, but I mean, under contract for
That should be taken off. It won't be a restoration, it'll be a build pavilion.
Yeah, it'll be a rebuild, yeah. And that is, the unique part of that is, that's not owned by the town of Farmington. That's owned by the citizens. There's a sign out there. This is owned by the citizens of the United States government.
Now, I will say this, that even though that's a local project, what I liked about that was the town board contacted me and they said, here's how much we're gonna pay with our ARPA funds, here's how much we're gonna pay.
And all these things, we're just looking for matching. We wouldn't be able to do the whole project alone. And a match to a rural community or municipality makes all these things possible.
Maybe rather than do it this month, maybe next month in our agenda, if anybody wants to make a case, or if you have, let me know in advance which of these projects that you want a deeper explanation of. I'll be
Yeah.
happy to do that.
I'd be willing to do that.
One other question, Vince. That study, the feasibility study, I'm not sure I know the whole story here, but the project that you were working on with the county board regarding a facility for I call it a convention center.
Sports rec.
Yeah, that whole process. Would that be a project that could go under this?
It could, but we didn't include it yet because I think with the ARPA funds, we're not there yet. We're not there with this concept yet. We may or may not go forward. We wanted things that might be more shovel ready now that we could have an impact.
Okay,
That would be a decision down the road, whether we go forward or not, and then how we would.
I would think if we own the property, it would be more feasible.
okay. Thank you.
Yeah.
Do we feel comfortable that all the towns and villages in the county are aware that we're even doing this? And that there's a possibility for them to be, requesting things?
Yeah. I can't say that everyone has contacted me or has been, you understand, I haven't sat down face to face with them.
No,
I think in many cases, in some cases, we're not getting a reaction from some towns. In other cases, they have contacted you all, the supervisors, and the supervisors have directed them, if somebody says, hey, I'd like to have a gas station on my street here.
Yeah.
The supervisor would say, well, that's probably not something we're going to do. And again, I think too, the whole purpose of the last board meeting was to help supervisors explain that we're looking at county-centric type projects first. But if you have a need which is unique and special and you want support, you can make your case. So many towns have come to supervisors and the supervisor has said, probably not going to fly.
Everybody's aware of this because every municipality and every township in that has
oh, they
something.
got ARPA funds.
Yeah,
But I don't believe it's widely known that the county's
that's
considering.
our job, but I felt as
As
supervisors.
supervisors,
explain it.
yeah,
And it's been in the newspapers
They're all aware of it.
Yeah.
that the county is doing this.
Yeah,
And down this path.
I've explained it to Alden and Farmington. They've been working on this project even before I got.
Yeah.
I'm sorry.
No, I was just gonna say, they're getting their own money too.
Oh, yeah,
Yeah.
yeah, absolutely.
I mean, even if it's a mile of road or something like that, they'd be thinking about it.
And we don't want to get personal. We don't want to get false hopes out there. Because some people have said, hey, I hear you got money. I want some. And it's like, what do you mean? It's like,
And everybody
yeah,
did.
give us some. And there was one request that said, I think you ought to take the 8.5 million and divvy it out to every county.
Yeah, I've heard that.
And that's just, giving the money away. And I think what the board said is.
But it's
we'd rather
supposed to be, according to the qualifications, it's supposed to be a need based.
It's not a wish list.
No,
Right.
Some people it is.
But I mean, there is flexibility there, but
I do have a point here. One thing that I really appreciated last Tuesday at the highway meeting and stuff is they brought the boat over that they just purchased, and we all went out and looked at it and stuff. The hands-on looking is the biggest thing for me. Because that thing is gorgeous. I mean, it's got everything.
What he means on that, like Amy on, the, Polk County Parks and Trails Recreation, we've always had a boat and we put that up for sale in the Wisconsin. Did it get sold? Yeah, I think.
Yeah,
it did.
9,000, wasn't it?
It went for 11.
11?
So we needed, it's like our command boat, we needed a new facility, and so that's what Joe was explaining, that at the highway meeting, it was on display for the committee. And I imagine it will be at some time for our county. Well, I think we've had good discussion on it, on ARPA. And one thing I wanted to do before we adjourn is, this is opening up for discussion that we have from supervisors before we adjourn our meeting is Sharon and I and Joe attended the Wisconsin Counties Association annual meeting at La Crosse 2 weeks ago. And we all sat in on some breakout sessions. And boy, did we learn the truth and the interaction and some things about in these breakout sections. And the one that was especially woke me up and turned the truth around from what I had heard 100% was that a broadband situation we have. I think it's something that we all wondered, knew something about, heard a lot about, but does anybody really know who's all getting connected and who isn't at what price? There was, the really truth came out. So I'm gonna turn this over to Sharon for a report
That's
on
an
it.
eye-opener.
Well, I had a fellow from the state, I have his name because we've been emailing back and forth, but I can't think of it off the top of my head. And he presented, and he put it, you know, he had his presentation, and he puts up in his PowerPoint that Wisconsin is the #1 state, or the top 3 for broadband expansion in the United States. And I said, did they look north of Highway 8 and counties? Because, you know, it's terrible in some of these rural areas. So then the fellow that was from Taylor County, Medford, was sitting right next to me, and he asked a really good question about the measurements. How do they measure this? Well, it turns out when they're measuring what areas have broadband, they go by census district, and they go into each state and each census district. And if one home in that census district has what is considered broadband, then it's all blocked off as they have broadband. So when you're applying for grants or whatever, if you're in a district that's blocked off, even though only one home has broadband, well, you're out of luck because you're not going to get the grant because your area is designated as having broadband. So I asked, our legislators, they know that this is the way it's measured? Oh yeah, they're aware. That's the way it's measured. I mean, it's like, ding, 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 is anybody home? You know, how can you get a true sense of who needs broadband? And then they had two different companies that spoke, the president of the companies, that they do broadband installation. And they get it in the streets, and then there's another step and that has to happen to get it into your home. And
Which is the homeowner's expense.
yeah, at the
And
homeowner's
the
expense.
broadband companies are paying to hook up nobody.
Yeah, yeah,
It turned out that
yeah,
the companies are getting filthy rich and nobody's getting hooked up.
well, they've spent 1.4 billion in the state of Wisconsin already on broadband expansion. And in this next budget, there's another couple $100 million allocated, 2 different spots that's allocated for broadband expansion. But for what it costs, I mean, these companies talked about what it costs them to bury those fiber cables in the different communities. I mean, if there isn't enough people on a particular area, they can't afford to do it, even with the grant money from the state.
If I could inform you, and I mentioned this at the last board meeting, I'm very excited to hear that because actually Polk County is jumping out ahead on that. We've hired a consultant to take, because of that census tract area and how false that is, we are actually
They
doing,
don't say it's false. They won't use the word false.
but we will provide high-speed internet access, hopefully, we think, to the street level. we can show where it is, where it isn't, and what percent of the population is actually has access to it. And when I say access, not just they've got fiber optic cable running by their house, we'll know the cost of it. Because if it's too expensive for the family to pay on a monthly basis or to bring it to their house, then they don't have it. They don't have access to it.
Sharon, now you were telling me an example in your township
Yeah.
where they went down a road where there's no homes, no nothing.
A whole
Just-
mile of road. We don't even plow it in, the town of St. Croix doesn't even plow it in the wintertime.
So what we'll do
And
with
the
this,
company got paid to put broadband down that road.
well, what we're gonna do with this then is look at our biggest opportunities and what is really there, which will help us continue to apply for grants. But it'll also help us to incent citizens or internet service providers to go to a certain area. And I think Polk County is going to take a lead in this because we've got very good internet service providers here in the county. What we also have are some of those larger national companies that don't really cater to our needs. They have us. They're not doing anything. So the whole intent of this is to develop a strategy of where we need to expand and incent and work with the internet service providers to get high-speed internet.
I actually didn't have to pay for it to get to my house because I went through Starwire, which is based out of Siren, and it was part of their grant. They brought it to my house for free.
Wow, wow.
And it depends, different projects and different companies do it. I got it free to my house as well.
This is another, I'm not a technology person, I'm probably the last on that end. But I would been telling everybody, through real estate and everything, if you got a real estate parcel here that has broadband, it's worth more than the place across the road. But now they telling me with this lot of new technology, broadband's gonna become, through the cable, it's gonna become more or less extinct because through the satellite, you're gonna be able to have something right in your home.
Well, that's down the road a ways.
I-
We talked about that too.
Yeah, I think the fiber optic cable is.
I just have a comment, when you were talking about the ARPA funds too, you had Osceola Broadband in there, and I know they're Century Tel linked over there, and that's one of those companies that is not doing it. So I think for our county focus, getting high-speed internet, like you've mentioned in the past, is going to bring people out here that will work from home and improve our area. The other thing is the cleaning of the lakes, however it needs to be dealt with, because that's a resource here. So those two things I thought were countywide. But when ours went in, when our Lakeside put it in down County Road G, if you elected to get it to your house when they were laying cable, you didn't have to pay. So if people know that it's going to go in on their road, then they can, at that point, get it brought to their house instead of trying to buy it later because it's several hundred.
That's the way it should be.
And that's what happened to us because now some on the road decided no, they didn't want it. Now they wish they would have, because if they went back $300-400 to get it to their house,
And Lakeland is quoting prices $3,000 to $5,000.
to get it to the house now. Well, at that point, it was several hundred in some segments, but that's the time to get it when they're laying the cable, because then they give you it free.
Anyway, I wanted to bring some discussion to the floor on this, so.
There was good discussion too. I attended a session on what one of the counties is doing, working with their sheriff's department on dealing with cases where there's sometimes mental health issues on the calls that they're coming in, and they've got a process that they use, software that they use too, that information is placed on the system. So when an officer is going to a particular home, they can pull it up on their computer in their car, that in their squad car, before they get to the home, to see is there anything particular about this person or this residence that they need to be aware of from past experience with that person or that. So they're going in more prepared. for some of these situations. It was kind of interesting. They were terrible presenters, but the presentation itself, when you took it away, the information was good. And they just didn't present well. It was one of those deals where there's a million words on the screen, you can't read anything.
And I will say, we have our basis for our 911 system is that type of system.
Yep.
And we have the direct to car information. It's just a matter of if we build those protocols or not. We have that plan.
They had some other things built around that too, that I thought I should share that with Sheriff Walk or somebody, and because it was interesting to hear, because it sounds like there are not many counties in the state that are doing that.
I attended the workshops on law enforcement and highways and that. The point that I took home was forget the county now, it's in my notes. The county that the sheriff was the presenter, and he was short 21 deputies.
Oh.
For that many. And one thing they've got to be looking for is our county people in the future. We just got to be looking to do everything we can for our sheriff's department and funding. Whole county now, we don't body cameras yet, and we gotta help out everything we can do in law enforcement. Getting more critical all the time.
I have one other thing. I met a young woman who's the chair of Milwaukee County.
Oh, she was impressive.
I'm telling you, we got to keep it on. She's going places. She was awesome. She really had some awesome ideas on a lot of different topics, but I had a chance to speak to her after one of the sessions, and she was impressive, really impressive. I mean,
She was very young.
I have her name written down.
Sent herself through college. She came out of, like, I would say almost some area. Her mama was from Alabama, her dad was.
Yeah, something like that.
Yeah.
But she was so impressive.
Only the best from Alabama.
Alabama, yeah, you're from Alabama. She was really impressive. And
Madam Clerk, did you get that comment? Something we got to strike.
But it was so nice to see a young person, and especially a young woman, in doing what she was doing and really dedicated. And she was the bright spot, I thought.
She was the chair.
Yeah, she was the chair. Yeah. Yeah, she was good.
Anything in number 15, identify subject matter. We already got a couple things, Tanya.
Will we have the command post discussion, or is that?
Correct. No, put that on.
We'll have a deeper dive on our.
Yeah, I think that's.
Including command.
And I would encourage you at that time, any budget amendments would be made. My hope would be that they come out of committee, not at the November.
Which is the same.
As a
day.
personal note.
Which is the same day, you guys. Our committee is the same day as
Yep.
county board.
We'll be here that
Fix it in the
morning.
morning.
We'll be here that morning. Is our regular board meeting at 6 o'clock, or do we have a pre-budget hearing?
I think we got the redistricting hearing at 5:30, the budget hearing at 5:45, and the regular board meeting starts at
What would
6.
the redistrict hearing be about?
We have to have a public hearing on the redistricting plan.
So we had that.
So
That was the tentative plan. The actual final plan has to go through after the municipalities have done all their ward lines. That was our tentative plan, then it's their chance to adjust their ward lines accordingly, and then we adopt the entire plan as the final.
Everything's in line.
So that board meeting is going to be on the 9th instead of the 16th.
Right.
And I will be joining you on WebEx for that,
For the
For the health and human.
HHS.
for the Health and Human Services. I'm sorry, not.
We have the 10th, but it's a health.
Supervisor Kelly, by statute, we have to have the budget meeting the second Tuesday of November.
That's the only time it's not on our third Tuesday.
Okay.
County.
Anything else, or we'll call for adjourn?
So move.
Second, got that, Madam Clerk? All in favor?
Aye.